Good afternoon, Taras. My name is Jamal. I'll be your student physical therapist today. Nice to meet you. Now, before we get started, I want to make sure I wash my hands, make sure we're in a sanitary environment. And I came across your chart, and I see that you've had been diagnosed with Parkinson's. How long have you had Parkinson's?
9 years.
9 years. Can you tell me how it's affected your functional capacity?
I get tired easier. It's harder to walk. Getting into bed and out of bed's hard. My legs, they're not as strong as they once used to be. I used to walk around my neighborhood. I can't do that now.
Okay, so you're experiencing weakness, and that's not allowing you to be able to do the things you used to be able to do?
Yes.
Okay, and do you have anybody at home that you live with that can help you with these activities?
My wife helps out, and I think we have some lady that comes and helps us, but she's only there for a few hours in the day.
Okay, so you don't have help at all times during the day?
No, I just sit on the times that I don't have help.
Okay.
Just read.
Can you tell me about your home environment? Are there stairs in the home?
Thankfully there's no stairs, but the hallways are big, so I do have a chance to use a walker, but I was just given a walker. They never showed me how to use it.
Okay, when you are walking around the house, you choose to use the assist device?
I kind of have to, because I fall.
Okay, so we're having some balance issues, that is.
Yeah.
And you're using a walker at home?
Yes.
Okay, so this is your walker, correct?
Yes.
All right, what I'd like to do is just kind of see where you are with your walking abilities, your balance and whatnot. During the course of this examination, there may be times where I may have to touch you for examination purposes. Do I have permission to touch?
Yes.
Okay, cool. Now, before we get started, I want to put on this gait belt and just ensure your safety when you're walking around the clinic today. Can you sit forward for me? Thank you. Bring your arms up. You can rest your arms down if you want. These gait belts are a little funny. There we go. Okay, now you said you've had Parkinson's for what, 9 years?
Yes.
All right. Can you tell me your date of birth?
I think somewhere in the 30s.
Okay. Can you tell me the last time you voted for a president?
I think it was Ronald Reagan.
Ronald Reagan?
Yeah.
Okay.
He's still in office.
He just recently was replaced by a newer president.
Okay.
But we won't talk politics today. It's all about you.
Thank
So
you.
now, before I have you get up, I'm just going to do a quick assessment on your range of motion, see how well you can kind of move your arms and your legs.
Mhm.
So if you can, just kind of follow my lead. Sit forward if you can. Very good posture. Bring your back.
I am sitting straight.
Okay. So I see that you have a forward posture.
Yeah.
Can you just bring your arms up for me? Okay. Relax. You bring them out to the side. Bring them back. Can you bend your elbows? Can you straighten them all the way out? Okay. Can you make a fist? Can you bring your arms out? Can you bring them in? Can you turn your palms down? Can you turn your palms up? Okay. We're going to do the same quick assessment with the lower body. You can relax your arms. Can you bring your right leg up? Bring it down. Bring your right knee out. Bring it all the way back. Okay. Raise your right toe up. Press your right toes down. Good job. Can you bring your left knee up? Okay, down. Can you bring your left knee out? back, as far back as you can. Slide that heel as far back as you can. Okay. Can you raise your toes to your nose? And press on the gas for me. Good job. Can you take your right leg, bring your foot in? Okay. Can you bring your foot out? Can you do the same thing to your left for me? In and out. Okay, can you bring your knees in? Push your arms right here. Can you bring your knees out? Okay, so we're having some general weakness, I can see, and a decrease in your range of motion. We're going to do just a quick strength test to kind of see where your strength is for both your upper and your lower body. Can you bring your arms out forward for me? Don't allow me to push you down. Relax. Can you bring your arms out to the side for me? Don't allow me to push you down. Can you bend your elbows for me? Don't allow me to pull you out. Good job. Turn them in like this. Don't allow me to push you in. Make a fist. Don't allow me to push you in. Don't allow me to push you out. Good job. You bring your left leg up. Don't allow me to push you down. Okay. Can you bring your leg out? Don't allow me to push you in. Okay. Bring your heel back. Don't allow me to pull you out. Okay. Bring your leg in. Don't allow me to push you out. Bring your leg out. Don't allow me to push you in. Oh. A little bit of weakness there on the left side. Okay.
Yeah, that's the one that gives me the problems.
I hear
this
you.
one and this one up here.
We're gonna do the same thing to the right side. Can you bring your knee up? All right. You bring your knee out. Don't allow me to push you in. Good job. A little bit strong on the right side. Can you bring your heel all the way back? All the way back, all the way back. Don't let me to pull you out. Don't let me pull, don't let me pull. Okay. Can you bring your toe and bring your foot in? Don't let me to pull you out. Can you bring your foot out? Don't let me to pull you in. Good job. Bring your toes up. Don't let me push you down. Press down. Actually. Step, press into my hand. Press down into my hand. Press, press, press. Don't let me to pull you out.
It's hard with that one.
I see that. Now bring your toes up. Don't let me to push you down. Good job. Right here. Press into my hand. Press into my hand. Press into my hand. Press into my hand. Don't let me to pull you up. Good job. Much stronger. And then bring your toes up. Don't. Oh, keep your foot on the ground. Bring your toes up. Don't let me push you down. And good job. Relax. Okay. So I see that, generally speaking, you're experiencing weakness both in your arms and in your legs, but the weakness is greater on the left side, the arm and the legs.
I feel that.
Would you agree with that?
Yeah.
Okay. We're going to continue with the examination. We're going to go through a neurological screening just to see if you have sensation intact and whatnot. In order to do this, I'm going to use a couple tools. First thing, I'm going to use this little brush. Can you open up your palm for me? I'm just going to go like this,
Okay.
across different parts of your body, on your arms and in your legs. You're going to do this with your eyes closed. And anytime you feel that you've been brushed, just say yes.
All right.
Okay. If I may, I'm going to have to roll up your sleeve on this side and on the other side. How you doing today?
Yeah, I'm doing well. I feel like I'm being treated well.
I'm glad to hear that. We're here to make you feel better. Alright, so if you can, just close your eyes and just indicate yes when you feel a light stroke.
Yes. 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 Yes.
Okay. Next part of the test, I'm gonna ask you to differentiate between hot and cold items. You can open up your eyes so I can show you. This object is considered hot or warm.
Mhm.
This object is considered cold.
It's cold.
You're gonna, I see that. You're gonna close your eyes, and when you feel hot, say hot. When you feel cold, say cold. Make sense? Okay.
Cold. Hot. Hot. Cold. 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 Hot. Hot.
So your senses are intact. That's good. And now we're gonna see your functional abilities. You say that you can open up your eyes. How you feeling?
Good.
Lightheaded, dizziness, anything? Okay. So now we're gonna assess your ability to walk using your assistive device. You said this is your walker, correct?
Yes.
And you use this around the house, getting the mail, things like that. Correct?
I don't go to the mail. Just to the kitchen.
Okay. And you feel pretty secure with your walker?
I do. I like it.
Okay, what I'm gonna do is place this in front of you. And I want you to demonstrate how well you can walk from here to the counter and back. You're gonna scoot towards the edge of the seat. Scoot all the way towards the edge of the seat. You're gonna lean forward and push up with your arms. Okay. Turn back around. You can turn to the right or to the left. Good job. Take a seat for me. Make sure you scoot all the way to the back of the chair. Make sure you feel the back of your knees on the chair. And then appropriate reach for the armrest on both sides. And come down. Good job. How do you feel now?
Tired.
Okay. So you need to work on your endurance so we can help you walk greater distances. Okay, now you mentioned earlier that one of the biggest difficulties you're having is getting in and out of bed. Is that correct?
It's very hard.
Okay, and that's probably limiting your desires to get up and move around, do a bunch of things because of how difficult it is to initiate those types of activities, correct?
Yes.
Okay, so after kind of going through just a quick examination, I can see that you're going to have issues, one, with bed mobility, getting in and out of bed. In addition, just strength issues. So I feel for you, appropriate interventions that we can use to help you with those deficits are just education on how to use proper techniques for bed mobility to get you in and out of bed, as well as PNF, which is a facilitation pattern to increase strength and range of motion for both your arms and in your legs. How does that sound?
Is it gonna help?
It should.
Yeah. Sounds good.
All right. You ready to get started?
Yeah.
All right. First thing I need you to do is to get up from the chair and to get onto the mat.
Oh, what's up?
To the best of your ability. I'm here to help. You're going to scoot towards the edge of the bed. You're going to use your arms. You're going to lean forward. Stand up. Stand up tall, stand up tall, stand up tall, stand up tall. Stand up tall. There you go. Reach towards the mat. There you go. And relax. Okay. Now that we're done using the gait belt, take this off so you're more comfortable lying on the bed. Any lightheaded or dizziness now?
No, I'm good.
Alright, perfect. Actually, we'll get this down. So the first thing I want to teach you how to do is how to get into a lying position on your back. So what you're going to do is, if you can, you slide a little more to your right. There you go. I'm going to bring this down for you. Make sure you're sitting all the way back, feet on the ground. Good job. Can you sit all the way back? Make sure the knees are all the way back. Okay, so from here, you're going to place your elbow down onto the mat. And as your elbow comes down, you're going to bend your knees, lift them up off the table. There you go. Bring them around. Lay flat on your back. So this is the technique you're going to use to get into bed. When you're sitting down, you're going to lean down onto your elbow, hike up your knees, bring them over the bed, and roll over.
Okay.
Fair enough?
Yeah.
Okay, now from here, I'm going to teach you how to do some rolling onto your side, which is going to help you as well with your mobility skills. Okay, so you're experiencing most of your weakness on the right side or the left side?
Left.
On the left side, so it's harder for you to use this part of your body to help you turn over that way.
Very
Correct?
hard. I can't.
Yeah. So we're gonna teach you to roll to the right. Or we're gonna teach you to roll to the left, not to the
Okay.
right, because we're not using these limbs in the transfer.
So I can use this arm.
You're gonna use this arm. So now, when you decide to roll in this direction where I am, you're always gonna move the arm that's not being used out of the way, so it doesn't restrict your movement when you roll over.
Okay.
All right. You're gonna bend your knees here to protect your lower back, and to make it easier for you to transfer your weight over. And with this right arm, you're gonna reach over towards the edge of the bed, and as you're reaching over, you're allowing your knees to kind of just drop down and roll over. I got you. Not bad, correct?
Well, it's easier.
Okay, so I'm gonna help you roll back to the side now.
Mm-hmm.
Bring your knees up. Pull back with your arm. There you go. And that's the technique you want to utilize when you're in the bed. Does that
Okay.
make sense?
It does.
Alright, so we're gonna bring that down. So when you leave here, these are techniques you can use as well. Now I want you to keep your arms to your side. And now we're gonna work on some strength. So I talked about PNF earlier, which was that facilitation pattern to help you kind of increase your strength and your range of motion within your extremities. We're going to work on your left side actually, just because I feel like this is where you're having greater limitations.
Mm-hmm. Okay.
And what we're going to do is just take you through a movement pattern. It's for neuromuscular re-education. So you see that you're having issues with your balance and things like that, strength, range of motion. This is going to kind of incorporate all those things that you're going to need to improve those skills.
Okay.
So what I'm going to do, can you slide towards the edge of the bed for me? Make it a little bit easier. Okay, so I'm going to take you through a movement pattern. Allow me to do all the work. And after you learn the pattern, I'm going to have you do it yourself.
Okay.
Okay? So I'm just going to bring your leg out to the side. I'm going to turn your toes in.
Mm-hmm.
Point your toes down and in like this.
Mm-hmm.
I'm going to apply a quick stretch down. I'm going to bring your toes out, up, in, like this, across your body.
Mm-hmm.
So, we're going to do that one more time. Bring your leg out, bring your toes in, push down, give you a light stretch here, pull up, in, up, just like that. And back down. So now I want you to help me to the best of your ability. So we're going to start in this position. Pull your toes up, bring your foot in, pull your leg up, cross your body, pull your toes up. Good job. And then come back down. And I'm going to apply just a little bit of resistance. You're going to do the same action. Pull your toes up, bring your foot in, bring your leg up, cross your body, bring your leg up, and resist, resist, push, 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 push. Good job, and relax. So that's the pattern we're going to utilize to help you increase your strength and your range of motion on the left side of your body. I know this is a lot, but it's going to take time. After the evaluation, are there any questions that you have for me?
Do I come back for another appointment?
Absolutely. So we're gonna get better.
I look forward to it.
Perfect. I appreciate your time today.
Thank you.
All right.